Welcome to the MamasteFit Podcast. In this episode, we have Lakeesha, who is a midwife that is going to be sharing two of her birth stories. Her first birth story, she was a labor and delivery nurse, and it was precipitous labor, which meant it went really fast and a lot faster than she was expecting. And then her third labor, she was a student midwife nearing the end of her midwifery school, and she had a really unexpected labor where her contractions were 7 to 8 minutes apart, and they never felt like a normal contraction for her. And again, she showed up at the hospital and her baby pretty much fell out of her body at the same time. So hope you enjoy this episode. Welcome to the MamasteFit Podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit Podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit Podcast Birth Story Fridays. On this episode, we have Lakeesha Murphy Spencer here to share her second and third birth story. Well, thank you for being here.
Thank you for having me.
So tell us, how did you prepare for your second pregnancy?
So my second pregnancy, by that time I was a labor nurse. So I was a brand new labor nurse. So I worked at a very high volume site. So it had made me very paranoid about giving birth and all the things that could go wrong, because it's just the culture of fear that they instill in that place. So I'm like, oh my God, I didn't even know all these things could go wrong. I'm just going to be so on top of it this time. And so I kind of went through my pregnancy. I had hyperemesis. I worked night shift. So that was not great. Very emotional about that. And so by the time I hit 27 or 28 weeks, I ended up quitting there and just kind of staying home and preparing. And the funniest thing, the thing that changed, I felt like the trajectory of how I wanted my birth to go, was I was on call. It was my very last night at work there. And I was on call. They put me on call. And so I just decided to watch some movies. In that movie, The Business of Giving Birth, or The Business of Birthing, or it's like a Ricky Lake documentary.
Business of Being Born?
Yes, that one. So I watched it and I was like, mind blown. What is going on here? I was like, the man is trying to get us. So I went in just full blown, research mode, Googling everything, and just me being a labor nurse now, seeing both sides, kind of felt like I was way more prepared than I was with my first. So I had this whole, this is how it's going to go. I needed to be this way, how you can sometimes get when you're trying to overcompensate from trauma from previous births. And so at the time I had a 4-year-old son, and my biggest worry was, what happens if I go into labor at night? I don't know what to do with him, because, it was an Army hospital, and I just didn't know if I was going to allow to, take him with me. And I ended up, I was 39 and 1. Or no, 39 weeks, I lost my mucus plug, and I didn't think of anything of it. I was like, okay, this means kind of nothing. And then that night, I went to sleep, and right before I went to sleep, I said, "Dear God, I just want my body back. I don't want to do this anymore." And by midnight, I was awoken by super sharp contraction, and I was like, "Oh wow, that was pretty strong." From there was no build up to that. That was just out the gate. So after one contraction, I was like, "Oh, guess this is it," and went downstairs and kind of thugged it out for a little bit with my cat. He was my labor partner. And I had my birthing ball, and whenever a contraction would hit, I would stand up and kind of pace around the room, and then in between I was doing hip circles or whatever. And 30 minutes goes by, and I was like, wow, these are super fast, super strong, on top of each other. And then I started panicking, well, what if I can't go unmedicated like I thought, because this is kind of already starting to get to me a little bit. So I went upstairs to wake my husband up. I didn't want to wake him up preemptively because I didn't want him to be tired during PT if it wasn't, the real thing. But when I started vomiting, which was like my hallmark sign in labor for me, that I was like, all right, here we go. This is what this is. So I woke him up and asked him if he could text one of my coworkers because she said, she works nights and, if I'm off, I can watch your kid. So she actually answered, which really surprised me, and she's on her way there. So I asked my husband at the time to fill up the tub for me because that's what brought me, the greatest comfort in my first labor. I got in the tub and immediately got back out because I was like, that is not the move. That's not, that did not feel great at all. And then I start even panicking even more because I was like, okay, I don't have any of the things that I thought were going to bring me comfort are not. So now I'm like, what do I do? It was more like the panic setting in. And, the panic makes the pain worse. So I'm over there like trying to squeeze out tears and I couldn't even squeeze them out because it was too painful. And he's like, what are you crying for? Like, this is what you wanted, isn't it? And I was like, I changed my mind. I don't want this.
Changed my
And
mind. How dare he?
he's very to the point. It's pretty funny. Like that was his way of being supportive, and I was like, okay, I can recognize that. So then
Appreciate it.
she gets there, and I said, can you check my cervix? I don't want to go in too early. And she's like, yeah, sure. So she checks my cervix, and she's like, you're like 9 centimeters with like a bulging bag. And I was like, okay, so we need to go. So I'm trying to. So I'm trying to tell my husband, like, come on, we need to go. And I don't think he really quite understood what any of that meant because he like was like, okay, let me hurry up and pack the rest of these bags because he was just determined to be, he said he was going to be the greatest labor coach. That was like all the birth classes. He was like, I'm going to be such a good labor coach this time around. Like, you're not going to have anything to say. And I was like, okay, whatever. And so I'm outside on the driveway, like talking to my son, saying bye to him, and they kind of leave, and I'm still standing there on the driveway, and I'm looking at the house, and we live on post, so it's like very close to the hospital, and all I see is like lights turning on and off, like all through the upstairs, and then like all through the downstairs, and I'm like, what is he doing? So then he finally's like running out, and I was like, what are you? He was like, well, like you said you wanted Jolly Ranchers, so I had to find the Jolly Ranchers, so you would have them when you need them, and I was like, all right, like get in the car. It's time
That's
to go.
sweet. Maybe not the
We're
time.
past
Like,
the
I
Jolly
feel-
Ranchers.
I was really sweet, but maybe not the time at 9 centimeters with a bulging bag.
Right. And then he stops at every light. Like there was no urgency. So then we get there and we're like going into like I think that this is the time when All American was still open. So I went there and they're like him and the little desk person, it's by this time it's like 3 or it's like 4 in the morning. Or actually even later than that. It's like 4:30 in the morning. So the front desk person and him are like fiddling with these chains where all the wheelchairs are locked up, and I'm just like shuffling past them like I don't understand what's even going on back there. They're trying to get me to get in a wheelchair. I don't care about that. I'm just headed to the elevator. So then like finally he like I've already like rounded the corner. I'm standing by the elevator waiting. They're still trying to unhook these wheelchairs that are all locked up.
He's trying so hard.
So then he scoops me up and he gets me to the elevator, and then he like runs through the front and he's like, she's in labor and all. He's like all frantic dad energy. And the front desk like, well, okay, go ahead and sit down and fill out these forms. And then he's like, she's like 9 centimeters. And they're like, oh, how do you know that? And he's like, well, her friend checked her. And I'm just kind of like dissociated from the whole, it's like everything else it was like a movie going on around me. And I was just kind of like, like all these people are talking about me, but I just felt like out, not in the experience. So then I was sitting at the front desk and I felt this urge to push. So then I just kind of like turned around and there was an open labor room and I just started walking
You just
towards
walked
it. And I was
into it.
like, I figure if the door is open, that means there's no other patient in there. And I walk in there and so the nurse is, trying to push me back into the wheelchair. And I was like, I don't want to sit. I don't want to sit. And I get in there and the door's not even closed and I'm like stripping down. So like this is probably how they were like, okay, she's in labor, because they just at that point sent him into the room Like they didn't even make him fill out the paperwork. And then they checked me and they were like, okay, you're complete. You just break your water. And that's when I could shed a tear. I was like, oh no, I don't want to do this anymore. And they're like, well, just go ahead and push and it'll be done. And so I did like a little practice push where kind of like I was revving the engine a little bit and just testing to see how painful it was gonna be. And I was kind of like, yep, that's about to burn so bad. And so then at that point I was just like, gun it, like pedal to the metal, just get it over with and be done with it. And I did. And she came out in one push. She had a double nuchal and she had a double true knot, and her double true knot was actually on top of each other.
Oh,
So
wow.
we didn't realize that had happened. So we get her out, and then they're trying to, I guess, get the placenta out. And they were having I guess it was getting caught up behind the cervix, so she had to go through and like sweep it out. And that's when we saw like the knots were actually on top of each other. So I ended up having a 2nd-degree tear because I had, I was kind of like in a squatting position. Oh, and the best part is right before I go to push, my ex-husband leans in and he goes, "Do you want your Jolly Rancher?"
Oh my
And
God.
I was like, now is not the moment for that, but thank you.
The
Read the
best
room.
labor
Read the
coach.
room, man.
So thoughtful.
He's like, I did everything, everything you asked me to do. And I'm like, okay, thank you, babe. Thanks for so much. And so then after I see that being a labor nurse, I'm like, oh my God, what did I do laboring at home? Even though like I couldn't have gotten to the hospital much quicker, but I was like, I was depriving my baby of oxygen. Like her strip was probably horrible because I had never gotten onto the monitor. I never got an IV. I just went straight in and had her, I think 9 minutes. I was there from the time I got there to the time I had her. It was 9 minutes. And so that made me feel, the mom guilt afterward,
Yeah.
where you're like, what did I do? Did I do something wrong? Is something wrong with her now? But she ended up being fine and is still like very, very vocal and smart and much like me. So maybe I feel, and this is just my thoughts on, like a little bit of spirituality into my birth. I feel she is my twin flame, so that's why I felt like it was the double nuchal and the double true knots kind of like on top of each other, like signifying her entrance into the world as my twin flame. So that's my little buddy for sure.
So you're a midwife and Roxanne's a student midwife. Could you guys explain to our listeners what a nuchal cord and true knot is? Because not everybody may know what that means.
Oh, yeah.
Yeah, so a nuchal is when the cord is wrapped around the baby's neck. So a double nuchal would be being wrapped around the neck twice, and then a true knot is actually when the babies have flipped and moved so much in utero that there is actual a knot in the cord. So a double true knot would be 2 knots.
On top of each other.
Yes.
Are those an issue, or is that like kind of a normal thing that could occur during labor or during birth?
It's so normal. It's so normal. I want people to understand how normal it is because I think it's a huge fear people have. And more often than not, the baby's somehow wrapped up in the cord somewhere or another. And they're getting more entangled and less entangled as labor goes on. So definitely not anything that we can prevent or do anything about.
And the umbilical cord has something called Wharton's jelly within it that prevents those blood vessels inside the umbilical cord from being compressed too much. So that Wharton's jelly is kind of preventing it from being compressed, even if it is in like that true knot. Like there are videos online of people like moving the true knot up and down the umbilical cord when it's there because that Wharton's jelly kind of prevents it from happening like too tight. When there isn't Wharton jelly, that's when it is kind of concerning.
Yep.
So how did you feel after you had an unmedicated birth? Were you like, yeah, I'm going to do that again? Or were you like, absolutely not?
No, after I was done, I saw how quickly the pain subsided and how the recovery was so much easier. I was up and walking. Like by the time my son came to visit me a couple hours later, by like 9 a.m., he came in, and brought me his little gift to me.
Aw.
And I was up and moving already, didn't have that numbness that lasted for hours, with my first one. So I felt empowered and I felt kind of like, and I still use this, like when I go through tough things, I'm like, you went through unmedicated labor. You can do this. Like I had like an ingrown toenail removed, and I was like, you can do this. Like you went through unmedicated labor. You got this. So anytime I feel like I face adversity, that's still one of those things that it's like I draw from that. So yeah, I felt pretty good about myself at that time.
I had a doctor ask me one time if I had given birth before in regards to whether or not he should offer me pain medication for like a mole removal. And I was like,
What?
are you trying to say that getting this mole removed is going to be equivalent to childbirth or like slightly less than that? Because I would like pain medication, please.
Please do not take that off without
I was like,
medication.
please, what do you mean? Like, should I lay down? Like, and I was like, it ended up not being bad at all. But I was like, why is that your question to me? Like, if I have, like,
Yeah.
Like 'cause some people who go unmedicated truly do not, like they go unmedicated because they don't like any medicine. Like they don't want to take medicine. But so maybe I'm gonna give him the benefit of the doubt, but probably
I was like, if I
probably
said
not.
no, would you definitely offer me pain med? But anyway, that just made me think of it. Where I was like, I mean, I have, but that doesn't mean that I never want pain medication.
But no.
So how was your third birth and preparing for that, and how does that story different? Because I know third is always a wild card.
Yes. So with her, with my second, I labored for maybe like 2 to 3 hours or so. Really like labored, and so I had a long time in between. Well, a relatively long time in between my second and my third. I had went through a divorce and I found a new partner, and we've decided to, now have one more child together, and which turned to two. But I digress. Um, I was actually in midwifery school, and pregnant, and so it was almost like taking my, education and knowledge now up to the next level. My Imani was now 6, I want to say. So it had been some time. And funnily enough, the school terms coincided with my pregnancy. So when I was doing my antepartum courses, I was antepartum. When I was doing my birth courses, I had given birth. And when I was doing my postpartum and lactation courses, I was postpartum and lactating. So it was a good sticking point for learning for me, because it was just kind of like I was learning about myself at the time. So, of course, I was like, okay, unmedicated is the move again, because the recovery was so good. I felt empowered. And honestly, looking back, because that oxytocin like dulls the sense of the real pain that there really was, you're like, okay, it really wasn't that bad. It was only 2 or 3 hours. It wasn't long. I got over it. The pushing was one push. The stitching hurt the worst, but, whatever. So I figured, we could just do that again, and I liked the recovery better. So that was the goal. So as the pregnancy goes on, everything's going well. Then March of 2020, everybody knows what happened. COVID hit, and all the plans I had made were like all of a sudden out the window, and my due date was May of 2020. So the first few weeks I was thinking, well, it's only going to be 2 weeks. It'll be fine, and it'll be over by then. And even if it's longer than that, we have time. It'll be done by then. And then after a couple weeks went by and I realized what was going on, I was like, oh my God. So I started scrambling, trying to look for home birth options, because it's like, as a pregnant nurse, you're still terrified because you understand what your job entails, but you also know nothing about this virus. So it was like really kind of scary at that point in time. Like, I'm sure a lot of people, know. And then like a lot of your experiences were taken away. So like virtual baby shower now, and like photographers were not being booked. I did I think my pictures out in my backyard with just a friend of mine. And so there was no kids allowed in the hospital, and we had to come up with an exception to policy, because we were just like, I really wanted my kids. That was the plan, where my kids were going to be in the room with me, and they were going to be able to experience, their sibling being born. And so the exception to policy went through, and May came around, and so I had just started, or no, I was towards the end of a term, I want to say. And we had to do a project. And of course, it's one of those projects where they're like, if you miss it, you're going to not pass this class and you can't make this up and yada, yada, yada. And it was the week of my due date. And I was like, great. So the teacher was like, just sign up for the first one that you can and you'll probably be okay. So the first one I was 39 and 4, and had given birth at 39 and 1 last time. So I was still not really confident that was going to work well. And so the day comes, and it's my day off, and I'm kind of having, what I'm thinking is like Braxton Hicks or whatever, uterine irritability. But I'm off. It's COVID. The kids are home with me, and it's just me at home with them. And I'm going about my day, doing my daughter's hair, cleaning, and all that. And just like every 7 to 8 minutes, I'm having like, a Braxton Hick. That's what I thought. Or I would feel like almost like a spasm wrap around my hips. And then after a while, there was no more Braxton Hicks contractions. It was all just in my hips. Like every, 7 to 8 minutes, it was just like a little spasm. And I'm like, okay, that's, it's uncomfortable. Sometimes I have to kind of be like, whew. But for the most part, I'm just going about my day. And then the afternoon comes and I'm having to do my little presentation. And the presentation, or the grade, or I guess the project, whatever, the assignment, was that we had to talk to a woman who was in labor and admit her. So it was one of the professors was pretending to be a lady in labor and when she was pregnant and pretending to have contractions, and I had to be the midwife admitting her.
While having
And
contractions.
she's pretending to have contractions, and I'm literally sitting on a pillow because that's how much pressure is in my butt, and I'm like sweating, trying to just get through this like 1 hour, class and assignment that's so important that I, can't miss. And every time she was just like faking her contraction, in my head, I'm like, you're not special. Like, me too. Like, you're not the only one contracting, lady. And so I get through that, and that ends at about 4:30 p.m. And then throughout the night, it kept on every 7 to 8 minutes. I was just like, this is annoying. So by 9 p.m., I'm like trying to get in the tub, just trying to like take a Unisom, relax. And Unisom always works for me. It always knocks me out. And when it didn't, by like midnight or so, I had text Renee and was like, this is ghetto. And she was like, those were the key words. I knew exactly what was going on. And I came flying. So she came, and of course she comes in with her little, like, she called it her doula bag. And it was like a suitcase full of all this stuff she was going to like, doula me with. And she checks me and she's like, you're 9 centimeters with a bulging bag. And I was like, I'd fucking again, like, damn it. Like, what? I like, for some reason, cannot gauge my own birth. You would think by now. And
With
that's
all
why I
your
was
experience.
well, and it's like, that's why I tell people all the time, like, what I hate when people say, oh, you'll know, because you don't always know. Like, and that goes for either way. Like, some girls come in like so many times, and you don't want them to feel bad, because it's like, how would you know? Like, how else would you know? Every labor is so different, and it feels so different. So at that point, I'm waking up the kids, or no, she goes, well, if you would like a hospital birth, then I suggest you go. And then she's like,
in
if you,
Renee's voice too.
yeah. And she was like, and if not, then we can do this. And I was like, okay. So before I even like got a chance to look over at my boyfriend and be like, okay, can we just do this? Because I had a kit there just in case, because I thought maybe precipitous delivery, who knows. And he was already like flicking on all the lights and like grabbing everything, packing
He's
bags,
like,
and
no.
like, yeah,
A little bit
waking up
more
the
urgency
kids.
this time.
Yes. So we wake the kids up, and they're, kind of like confused as to what's going on. We get there, we realize this is when they started shutting down All American more.
Oh, the gates.
Because of COVID. So we get there, we pull up, and it's shut down. And I was like, I can't get back in the car. Like, I can't sit down. Like, every bump that he drove over was just ridiculous. I was vomiting. And then I was like, if my water breaks while I'm in the car because of my vomiting, it's over. Like, we're going to have a car baby. And
Worst fear.
so by the time I realized I can't get through one side of the hospital, I was like, I'm not getting back in the car. So I walked all the way around the outside of the hospital because I couldn't sit back down. And by that time, I had texted the people up on labor and delivery that I was on the way, and I was feeling kind of pushy. and they had a room ready for me because they were like, we know what you did last time. And I can't.
You claimed a room.
Yes, and they tried to put me in the same room, but it was taken, so they put me in one right next to it. And so I come in, and the doc is like doing ultrasound, making sure she's head down, and then they check me, and then she's like, "Would you like a midwife or an MD?" And I was like, "Midwife, duh." And then one of my preceptors actually came, and she was my midwife. They broke my water, and as soon as I felt her head settle down on those bones, I tried to get back out of the bed and leave the hospital. Like, no lie, I felt it, and I was like, nope, not doing this. Like, it's always that right before the pushing where I'm like, nah, I want out of this. And so everybody's like, where do you think you're really going to go? And I was like, I really don't know, but whatever you guys are requesting of me is not what I want any parts of. So of course they're like trying to tell me like, okay, you have to sit back down. So, and then they keep leading me back, and I'm like trying to like force my way forward. Like, no, I can't lean back. And they're like, all right, all right, all right. And so then we ended up doing, I don't know, again, 2 pushes or so. And she came out, no tears, but I still hadn't gotten an IV or anything like that. And I ended up having like a silent postpartum hemorrhage. Like, I had barely crossed the threshold or into it, and I didn't feel anything. I was asymptomatic. So there wasn't much to be done after that point. But yeah, that was this story of my 3rd baby, Mrs. Indigo.
So how did you feel after this birth in comparison to your previous births?
I felt good about it, but it also threw me for a leap that it was so different. Like, I never had abdominal contractions. After the Braxton Hicks left, in the early parts of the day, it was only that sensation of a band being like, it was almost as if someone had a exercise band and they were just like intermittently tightening it around my hips, and then that was it. And they would let it go, and then it would just tighten again. So sometimes it would be kind of like it was squeezing a lot, and sometimes it would be squeezed, but it's only every 7 to 8 minutes. So I thought at some point the pattern would pick up or increase, and there was no really physical changes in me when I got to that transition point that I didn't know I was at, because other than, I just was restless. It didn't, the pain didn't change, the sensations didn't change. I couldn't get comfortable. So it was eye-opening to know again that labors just go differently within the same body. So many times it'll just go from one extreme to the other.
It is wild. Like, our labors, I find, are fairly similar, but they also have like some really distinct differences between them that make it very confusing. And even for me, like going into my 4th birth, I'm like, I know at the end I'm going to be like, is this labor? Like, is this a contraction?
Yeah, I mean, like, I'm texting Gina when I'm like contracting every 2 to 3 minutes. I may be in labor. I don't really know. Like, it could be nothing.
You need that objective, like,
Yeah.
Sometimes you just need that objectiveness. Like, okay, tell me what to do. Like talk to me like I'm 5. What do I do?
Yeah, I'm also like right before I know, like I know when I'm like, it's time to push, I'll be like, but I don't want to. I would like to opt out, please.
No, I think I said this during my birth. Like, as I was crowning, I was like, this is when I regret not getting an epidural at this exact moment.
But then they come out and it's like,
so
I'm amazing and it's awesome.
Yeah, when
But
they come
man,
out, yeah. But that whole
that
like,
moment before
burning sensation, you're like, I not do this?
The fear of the change in pain, because it's like, okay, I've mastered that pain now. I've mastered the contraction pain, but now this is going to be an intense and acute pain. This is not like a rhythmic thing that I can get away from.
It is a really different level of intensity, because it's definitely painful, but it's like the pressure and the like, I can only describe it as just like lots of intensity, but that intensity is so distinct and different than contractions that it's like
can be overwhelming.
It scares me before every time. I'm like, I know what this is, but I'm scared.
Yeah. And you don't know like how
Hence
long
why I try to
you're
leave the
doing
room.
it. Yeah. Yeah.
I don't blame you.
You're not the first person, though, that has told me when they've had previous precipitous labors that their subsequent ones they either only felt in their hips or their butt. Like one lady, she's like, I felt all of my contractions in my butt, and her previous 2 were precipitous. And then this
Yeah.
one like wasn't as precipitous, still fast, but like her contractions were far apart. And she's like, I only felt them like in my butt and like upper thighs.
Yeah, it did. It felt almost like a bad period in my thighs.
Yeah. So that's interesting. I wonder.
Yeah.
Did your birth experiences help inspire you to become a midwife?
My first one did. Funnily enough, I named my son Malachi, and that means the messenger. And I felt like my first one solidified that that's what I was meant to do, and there was never a question. And I've never questioned what I was supposed to do since then. I've questioned the route that I had to take to get there, and the lack of appreciation that we're shown in society that is frustrating. But the births were after the first one were more just solidification and giving, and I felt like everyone was an experience that I can now help my patients with or like relate to. Like my last one, I had to be induced, and that prior to that I had never had an induction. So now that I've been on that end, and I've been on the end of having an epidural, I've been on the end of having 2 unmedicated births. So it's kind of like I have a wide range of experiences that I'm able to share with my patients.
That's amazing. Well, thank you again for coming on our podcast and sharing your stories. Where can our listeners learn more from you? Because I know you have a YouTube channel with Renee.
Yes, so we have Safe Space Talk on YouTube. And then our Instagrams are, mine is the Hood Midwife _Quiche, Keesh. And then we have Renee, who is the Inclusive Midwife with underscores in between each. So the Inclusive and Midwife.
And we'll link them all in the show notes.
Perfect. Thank you for having me.
Yes, thank you again for coming on and sharing your stories. And I think our listeners will really enjoy it.
Thank you for listening to the MamasteFit Podcast. If you want to learn more from us, be sure to subscribe to our channel so you get notified whenever we release new episodes. We release new educational episodes every Wednesday and new birth stories every Friday.
If you're looking for more support during your pregnancy, check out our childbirth education as well as our prenatal fitness programs. We have a prenatal fitness program that is app-based as well as an on-demand program, and then also prenatal yoga. If you're in the postpartum and you're looking for either a fitness program or an education course, we have both of those as well. Our fitness program is also offered in an app format as well as an on-demand, and we also have postpartum yoga.
If you're a professional and you want to learn more from us and earn CEUs, you can join our birth worker course and our prenatal and postpartum fitness trainer course. And as a thank you for listening to the very end of this episode and not skipping over when we started telling you about how you could buy things from us, you can use code STORY10 to get 10% off any of our online offerings.